So good afternoon everyone. So today I will be performing an abdominal examination on Miss M, a 45-year-old lady of Malay ethnicity, Para 2, presented to the hospital with complaints of heavy menstrual bleeding, intermenstrual bleeding for the past 3 months. So good afternoon Miss M. So I'm a medical student from Taylor University. So today I would like to perform an abdomen examination on your tummy to check for any possible causes of your complaints. So is it okay with you? All right, so splendid. So before I start my physical examination, I would like to have a patient properly positioned on the supine position with good natural lightings and my hand properly sanitized, especially during this COVID pandemic. And so before starting abdominal examination, I will need to start the general examination to check for her vital signs and any evidence of shock and any clinical sign of anemia, as the patient has been bleeding for the past 3 months, and check for any signs of pedal edema as well, and check the patient in general, is there any sign of cachexia or not. So after general examination, I would like to start off the abdominal examination with inspection at the foot end of the bed. So I expose the patient properly from the xiphisternum to the suprapubic region to protect. Ideally, I would like to expose from the nipple line up to the mid-thigh areas, but to protect my patient modesty, I expose the patient adequately. So the patient has a full abdomen, and there is an obvious mass located at the suprapubic region, and there is no hyperpigmentation or hyperpigmentation. Umbilicus is centrally located and inverted. All the 9 quadrants of the abdomen synchronized with the act of respirations, and there is no surgical scar seen, and there is sign of striae albicans as an evidence of previous pregnancy. All right, so next I would like to proceed to the palpation of the abdomen. Right now I'm going to perform a palpation on your tummy right now. So please let me know if there's any discomfort or any pain on your abdomen, and I will stop immediately. So before I start my palpation, is there any pain around your tummy? No? Alright, that's good. So right now I would like to perform a superficial palpation across the 9 quadrants of the abdomen systematically. So I would like to start off with the left hypochondriac regions on the same level as the abdomen, and using the palm of my fingers to palpate. So on superficial palpation, all the 9 quadrants of the abdomen are soft and non-tender. There's no guarding, no rigidity, and no superficial mass felt. So Miss M, right now I would like to proceed with a deep palpation to check for any deep mass or any deep tenderness, and bear with me if there's any pain. Is it okay if I proceed? Okay, that's good. So just breathe in and breathe out normally. In, out, 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 in, out. So on deep palpation, there is no guarding, no deep tenderness, no rebound tenderness. However, there is a mass located. For the deep palpation of the mass, I would like to measure for the size, the site and tenderness, the consistency, the surface, the margin, and the fixation and mobility of the mass. So using my broken measuring tape. Alright. Similar to a leopard maneuver, I would like to feel for the size of the mass and the shape, the surface, and the mobility. So the site of the mass is located at the suprapubic region, measuring about 6 by 6 centimeters, approximate to a 18 weeks gravid uterus. The consistency is smooth and it is circular in shape and a well circumscribed margin. For the mobility, it is mobile horizontally but not vertically. So I would like to proceed my examination for any organomegaly. So for examination of the organs, I would like to perform percussion during the palpation as well, so that I will not trouble the patients that much. So starting off with the liver. So Miss M, I would like to palpate for your liver right now. So from the right iliac regions, during inspiration, I will palpate to feel for the liver. In, out, in, out, in, out, in, out. So could you put your fingers? Alright, there's no hepatomegaly felt. So I will confirm this with liver dullness. Okay, put your finger here and I will measure for the size. I forgot to ask the patient place the finger here as well. So the liver dullness is around 7 centimeters, which confirm for the deep palpation for the hepatomegaly. There's no hepatomegaly, and as the size of the liver span is around 7 centimeters. So right now, I will try to feel for splenomegaly. So starting from the right iliac region as well, go diagonally, in, out, in, out, in, out, in, out, in, out. So on palpation, the spleen could not be felt. So right now, I would like to ask the patient to lie on the right decubitus position to further felt for the splenomegaly. So similarly, I will repeat the position, the procedure, and palpate diagonally as well. In, out, in, out, in, out, in, out. There's no splenomegaly felt and the tip of the spleen could not be felt. So I would like to confirm this by percussing the trap space. So the trap space is resonance, therefore it confirms my deep palpation for the splenomegaly. There is no splenomegaly on deep palpation. So right now I would like to do a bimanual examination for the kidney as well. So I would like to start off with kidney ballotment. So Miss M, could you breathe in and out as well? In, out. Alright, in, out. Alright, there's no, the kidney is not ballotable. So right now, I would like to proceed with percussion. The percussion sound of the bowel and check for any sign of ascites as well. So according to the 9 quadrants of the abdomen, Alright, all the 9 quadrants of the abdomen are tympanic on percussion. However, there is diminish in the sound of percussion on the suprapubic regions approximate to the mass. So right now, I would like to check for any sign of ascites with shifting downwards. So right now, I would like to flip the patient in the left decubitus position. Okay, Miss M, could you face towards your left side? Okay, wait for 15 seconds and palpate and percuss for any shifting downward. So since it is tympanic of percussion as well, therefore there is no a sign of ascites and I would like to do the fluid trial as well. Miss Yang, could you put your hands in the middle of your umbilicus here? Alright. So fluid trial is negative as well. So right now, I would like to proceed with auscultation for the bowel sounds for around 1 second to check for whether there is a hyperactive or hypoactive bowel. So bowel sound is around 4 in 1 minute. It is normal, and there is no renal bleeds or aortic bleeds as well. To complete my physical examination, ideally I would like to perform a pelvic examination comprising of both bimanual examination and both speculum examination. So in bimanual examination, I would like to differentiate whether it is a uterine mass or an annexal mass more accurately. As for the speculum examination, I would like to check for whether there's any clots or any active site of bleeding and any